Okay, good evening. My name is Gill. This is my audience of 8 people, all in here. Okay, there we go. We're good. Okay, good evening. My name is Gill, and before we get started, did you know that over 1.1 million people have AIDS within the United States of America? Now, this is a very large number, and I think in today's society, when we hear large numbers like this, they can be a little taken out of perspective. To put it into perspective, that's an 11 with 5 zeros after it. It's a lot of people who have AIDS. So AIDS is obviously a terrible disease and one that needs to be combated. Millions of people have been infected over the years, and the need to continue the progress that is being achieved within the status quo is imperative. The intended purpose of my speech is to show you that the federal government is doing a good job within their plan and strategy to prevent and control the spread of AIDS. So before we get started, a quick overview. We're going to talk about the current plan, how it has a clear direction and goals. Then we'll look at the progress it has achieved so far. And finally, we'll discuss the disadvantages of implementing a new plan. So let's get into it. The current plan, how it has a clear direction and goals. Above anything else, it's focused on the prevention of AIDS. Jeffrey Fisher in the academic journal Psychological Bulletin says, because HIV is communicated by specific patterns of risky behavior, it can be prevented by behavioral change. So basically what he's saying here is, if you can prevent the behavior from happening before it even starts. And that's why prevention is more important or more effective than a cure. We'll talk a little bit more about that in a second. Two main things to look at here. It's focused on the prevention of AIDS by working toward clear goals. From whitehouse.gov, the 3 main goals that are outlined within the federal government's strategy to prevent AIDS are reducing HIV incidence, increasing access to care, and reducing HIV-related health disparities. So we have a clear direction we're headed and clear goals along the way to get there. The second thing is by focusing on prevention, not a cure. We talked about this a little bit beforehand, that we're going to go into it more in depth. So Richard Horton in the academic journal Aboriginal and Islander Health Worker says, from the very beginning of the global response to the AIDS pandemic, prevention has been marginalized. Treatment has dominated, and this systematic imbalance in clinical and public health programs is largely responsible for the fact that around 2.5 million people become newly infected with HIV/AIDS each year. Now, these are global statistics, but they apply to the United States. Basically, what he's saying here is that we've been focusing on curing AIDS. So people are still getting infected, and instead of trying to prevent them from getting infected in the first place, we're just trying to cure them. So the evidence is clear that it's definitely a more effective strategy to prevent something before it happens rather than trying to do something after it happens. The second thing about the current plan is that it is comprehensive. Every area of AIDS that we know of is targeted. From AIDS.gov, we have every different type of racial group is looked at, every type of sexual orientation, all these different areas that we know of that AIDS are prevalent is focused on and targeted within prevention. And then within that, every area has a goal it is striving toward. From whitehouse.gov, we have statistics like lower new HIV infections by 25% by the year 2015. Increase knowledge of HIV positive status to 90%. These are just a few of many. And we see that we're, again, moving towards a clear goal and we have a clear direction. So that's the current plan. Now it's time to look at the progress it has achieved thus far. First of all, an exponential amount of money has been saved. Estimates from the Center for Disease Control.gov show that $355,000 per life prevented from having AIDS is saved. So when you do the math, this comes out to around $129 billion saved within the current program. Paul Farnham in the Journal of Acquired Immune Deficiency Syndrome says the overall estimate of $129.9 billion is conservative because some HIV patients in the earlier period would have adopted the more extensive treatment regimens as they were developed over the course of their lives. So we see that $129 billion is actually a conservative figure for how much money has been saved under the current program. The second thing with regards to progress is that vital statistics have positively increased or decreased, including a rise in testing rates and a decrease in the number of new infections. These statistics come from the cdc.gov. More Americans than ever before are getting tested for HIV. According to a recent CDC analysis, the proportion of adults who had ever been tested for HIV increased from 37% to 45% in 2010. That's a huge increase. So we see that progress is happening. And then in addition to that, infection rates of infants, individuals who inject drugs, and heterosexuals have all seen decrease in the recent years. So the progress is exponential, the amount of money saved is exponential, and we see a great amount of progress under the current plan. So finally, it's time to talk about the disadvantages of implementing a new plan. Basically, if we adopt a new plan, we destroy the progress we have obtained thus far. The plan I'm going to use as an example is the HIV Secondary Prevention Plan by the Advisory Committee of the New York City and New York State Prevention Planning Groups. And the first thing I'm going to look at is that this plan is not comprehensive. The definition of comprehensive, according to the New Oxford American Dictionary, is complete, of or pertaining to all areas of a subject. Under this plan, and this is just an example of one that many different types are used like this, we see that it is not comprehensive. It does not solve for issues like transmission through breastfeeding. Infants can contract AIDS through breast milk. Espertazzi, in the book Disease Control Priorities in Developing Countries, says HIV transmission predominantly occurs through three mechanisms: sexual transmission, exposure to infected blood or blood products, or perinatal transmission, including breastfeeding. And within this plan, we see that it does not solve for that, so it is not comprehensive. And second, secondary prevention, which is what this plan is, does not seek to control the spread of AIDS. Primary prevention is when it seeks to prevent the cause from happening before it actually happens. Secondary prevention is when it seeks to cure the problem after it has happened. This is a secondary prevention plan, and the definition right at the beginning, secondary prevention in general refers to early detection and prompt treatment of a disease. Nowhere in there do I hear anything about prevention before the disease happens. If you're going to have a successful plan or policy against the spread of AIDS, to control the spread of AIDS, it must be a prevention plan. You can continue to cure people for the rest of your life, but if others are still spreading it, you're not going to stop it. Finally, Stephen Safran in the academic journal Clinical Infectious Diseases says, in the absence of a vaccine or cure, behavioral change remains the major method to prevent transmission of the HIV virus. So again, behavioral change is what needs to happen for prevention, not seeking to cure the disease after it's already happened. So, in conclusion, we've looked at the current plan, how it has a clear direction and goals, the progress it has achieved so far, and finally, the disadvantages of implementing a new plan. Again, the intended purpose of this speech was to show you that the federal government is doing a great job in its strategy against HIV/AIDS. I hope I have persuaded you that the work they are doing is both effective and producing clear results. Thank you.